It is 5:30. We'll call to order. Lynn, can you certify that the open meeting law requirements have been met?
Yes.
Thank you. First up, we have the public comment period. Members of the public will have 15-minute block of time to comment on today's agenda items. Members may be present in person or call in to make such comments. To comment by telephone, please call 715-538-1894. And public comment may be extended or curtailed at the discretion of the committee. Jay, do we have any members of the public there?
We do not.
Okay. So we will move on in case we were to get a phone call or something. We can take public comment if need be. Next up, we have approval of the agenda. I believe everybody has a copy of that in their packet.
Yeah, I'll move to approve.
Second.
Was that you, Dr. Breidenbach?
And that was Dawn.
Dawn? Okay, thank you. So motion made by Dawn, seconded by Kevin Adams. All those in favor of approving the agenda, say aye.
Aye.
Aye. All right, that carries. Next in your packet, you have the October 7th minutes.
Yeah, I'll move to approve.
I'll second.
Okay, motion by Dawn, seconded by Lori. Those in favor of approving the minutes, say aye.
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 Okay. So first up, I believe I will give this to Jay. In your packet, you'll have the resolution of the merger of the Health and Human Services. So, I'd like to start out that this is a conversation and to include any comments, that this board may have and have any questions answered at this point that they may have. Go ahead, Jay.
So we, and by we, I mean Rebecca, Susan, myself, Tricia, and we did touch base a little bit with Jen before.
Jay, can't hear you.
Darn it, that's the
Thank
first time
you.
I did it tonight. It was really good at the Human Services Board meeting. All right. So we, Rebecca, Susan, Tricia, and then Jen Como for a little while, and I have been meeting about this merger, and we looked at a resolution from the Door County Board of Supervisors from, I think, 5 years ago when they combined their boards, when they went to Health and Human Services as well. And so we tailored our resolution to that, obviously making adjustments for our county and different timelines as well, just that seem to fit the situation here. So there's a lot of pieces to this, but basically the statutes are listed that would cover this. There's language in the statutes for merging the two departments, and so we've tried to include all of that in here that's relevant, as well as the statute numbers. So some of the specific pieces in here, to boil it down a little bit, because I know it's a little wordy, but once this happens, we would include the word health in the department's title, and so we would become the Department of Health and Human Services. And timeline-wise, what we thought would make sense would be December 1st, because that would be after the November 12th full county board meeting, and so then they would have a chance to vote on this resolution as well. And that, one thing that, to back up for a minute, one thing that when I was talking with Dick Miller, he's the chair of the Human Services Board, he said it would be a good idea to have both boards jointly introduce this resolution, or he recommended that, and I believe, Bridget, you were in favor of that as well, or didn't have any objections to that. So that is what we did. December 1st made sense, and actually, to be honest, we've started heading down that path already just because we had that vacancy from when Jen left, and we wanted to make sure that there was no, vacuum there so that the staff are supported, and so a combination of folks have been providing support to the department. We did bring in Chris Hovell, so she was formerly the Jackson County Director of Health and Human Services, and she was the health officer here for a number of years as well. And so she is the Health Department Manager. She's an LTE county employee right now. And then we are also in combination, because the state requires us to have a health officer interim. And the person has to be full-time, and Chris is not full-time, even though she has all the qualifications. Because she's not full-time, she can't be the health officer. So we found internally that Nanishka Ruiz does have the qualifications, and so we have asked her, and she has agreed to serve as the interim health officer just for the functions that require a health officer for the department. Chris Hovell will be providing consultation with her, and so they'll be putting their heads together to make sure that everything's covered from a state perspective, but also from a department operations perspective too. So and Tricia and I are kind of jumping in and filling the gaps as well, as we need to. So I think there are basically four of us that are really trying to support the department the best we can, and so that there's no gap. So that's why we set it December 1st. From a practical standpoint, the sooner the better, to make sure that we can start synergizing operations and putting things together as well. So. So next Tuesday, Rebecca is going to be putting forward Nani, she goes by Nani, so Nani's appointment as the interim health officer to the full county board, and we'll be asking them to vote on that. Then the other piece of this is statutorily to transfer the health department within, or to merge the two departments, basically. The statute talks about transferring the powers and duties of the health department to human services. That's how the statute refers to it. So we just mirrored that wording. Let's see. And so then at that point, the health officer position will be placed under the supervision of the human services director at that point. What we wanted to do also is to give a little bit more time prior to looking at how we would combine the two boards. And so we stepped that out a little bit, and because this will be a recommendation from Rebecca to the full board, obviously with input from both the Board of Health and the Human Services Board, we wanted to give that a little bit more time. And so this resolution directs her to come back to the full county board on January 20th with her recommendations based on input that she's received and the statutory requirements as well for how that could look. And to that end, I did put in here the statutory composition for both boards. We have both of those handouts in your packet. And from when I was looking this over, and we discussed this a little bit in the Human Services Board meeting as well. Obviously, our cap for this board is going to be nine members. And looking at the requirements for both board, it will probably end up being 5 to 6 county board supervisors and 3 to 4 community members, which obviously we also need Dr. Breidenbach on there as our medical director here. And so we've got a few other folks that we'll have to look at and figure out what makes the most sense based on these two, because there's a cap of 9 members in the Board of Health statute, and then it could be between 7 and 15 in the Human Services Board. So that's kind of putting these together and making recommendations that make sense is Rebecca's job.
Lucky girl.
So did you want to add anything?
Well, I was just going to say, so I shared with the Human Services Board is saying, I'm not just going to go this is my decision, and, you know, I'll talk with everybody, and we'll try to come up with a way to take that forward and gauge everybody's interest, and then try to figure that out together. And we're thinking that there might be some, you know, that there might be a little bit of, I don't know what I want to call it, just overlap, I guess, or whatever, for a little bit as, you know, people finish out terms if they wanted and things like that. But maybe that we might consider how some people are more non-voting advisors or things like that, if they really wanted to stay involved, so that we have that transition time, so. But anyway, I will talk with each of you and we'll get an idea of how to move that forward. Just want to, though, point out to this committee is saying that Jay and Tricia have done a fantastic job, and just, I feel really comfortable where we're at and how we're moving things forward and being very careful about those things and doing, I think the communication's been very good, and we've just been working it out. And how did the, what's that called, the Health Department State 140 review go, or is that on here?
It is on
I'm
the
sorry.
agenda. Yeah, that's okay.
That's right. That it's this committee. Okay, thank you. I'm done.
So that's where we are with the resolution. I wasn't sure. I'm sorry, Bridget, go ahead.
No, go ahead, Jay.
I was just gonna say, I wasn't sure if anybody had input at this point in time, or if you had any questions, or. Sure, absolutely.
Since the last meeting, but I never heard anything about a merger of these two departments until now. What is the,
Jay, do they have a mic?
sorry. What is
Nope, it's all right.
what is the reason and why the rush?
So Jen Como took a different position.
Right.
And so with her leaving, that was a lot of the discussion and consideration. At the last meeting, health board meeting, it was discussed at that point as well. And then at the Human Services Department meeting as well. And I don't think it's just been conversations and continuing, and there's been interest on both boards
It
to move
just to
this
me
forward.
seems that since, as a member, and not hearing anything about it, not getting any input as to what was going on, when I read that, when I got sent the agenda, I was like, what is this? Having no no reason to even anticipate that this was happening. I just was very upset. I've been involved with the health department since 1971, and it just, to me, seems like it's push, push, push. And there's not been input from the members of the committee, and it really is upsetting to me. Not that I think it's all bad or all good, but just the way it's being pushed through, to me, is very upsetting.
Can I just respond to that? Is that all right?
Certainly.
Well, maybe it does feel like it's being pushed through because you weren't at the last meeting, but I know we had a lot of conversation there at that meeting, and we're all.
One meeting.
Yep,
One
but the
meeting.
thing is that with the retirement, my understanding is with Jen having moved on, you know, you don't want to hire somebody into that existing position. Like, the opportunity is now to make a change, given that that position is vacant. And I know when I started to first get involved in the county and was looking at like all of the different departments that are out there, not that I was on either of the Board of Health or Human Resources Committee, but when I was just looking as a whole, one of the things that struck me was that I thought it was interesting that there were two separate departments and two separate boards. So I spent a little time doing some research, and it is much more common than not to have both of those departments under one roof for a lot of good reason, but mainly because I think it really can improve efficiencies and helps the patient get connected, or patient or person, it's a patient to me, get connected with all of the services that they need, and oftentimes it crosses both of those areas, both the public health services that are provided and the human resources services that are provided. So I'm very much in favor of moving forward, and I don't think we have the luxury of going slower. Maybe I'm wrong about that, but I know we have to have somebody named in, in certain, nanny has to be named in the position you were just talking about, and there has to be leadership over that department. So I guess those are just some thoughts.
I,
To me, the
I-
health
I do know-
department needs to be managed by someone that has health background and knowledge.
That is a requirement, yes. That is true.
So,
That is what we would have to do. The difference is instead of it being a director, the person would be a manager. And the director then oversees both human services and the health department so that they're coordinating kind of between all staff for the communication and working together. But you absolutely are correct, and we want to make sure that we have a focus still on the health department, so that person, they have to be a health officer, and they have to have all those requirements to be the manager of that department. They're going to oversee everybody in that department still, yeah.
I do have a question. If people in the public are wondering why we're merging, what would be a good answer to give them, you know? There might be people like, oh, why are they doing that?
Sure. Let me, we have a list. Let me grab that real quick. Because it might be more comprehensive, I think, too. Are there other things that we want to discuss while I look for that?
I guess I was looking at the org chart. And I've not ever seen an org chart for either, well, or at least that I recall. Maybe I have, but not that I
It was
recall.
my best stab at the effort there.
Yeah, no, but it just led to some questions that I think I would have had regardless of
Sure.
what we were talking about.
Right.
I was just seeing so if we bring I guess my main question is about the fiscal supervisors. First of all, I didn't know there were that many. And I know there is a lot of financial stuff within that department because of all of the shared revenues with the state and so forth. But I'm curious, I see Lynn, she's been the financial manager for the health department for some time. But I see her reporting still in this change to Chris temporarily, and then
Right,
whoever.
Right.
But then, under the health department, we have the fiscal supervisor with fiscal associates reporting to that person. So that seems just a little bit weird to me.
Right. So as far as, it's kind of similar to the board conversation, where that's the current state. Do I know what the future state is going to look like right now? Nope.
Right.
It's a starting point,
I
sure.
think one of the things that we want to look at too is who's doing what, because I think there's some duplication, and so how can we become more efficient? Lynn's got a lot of strengths. I mean, Kelly and her staff have a lot of strengths too, so we got to look at who does what well, and how can we organize it so that we're working smarter, not harder, the old adage, But I think there's some efficiencies to be found there, just like there is with the programming side of things. So the answer is I don't know what the future is going to look like.
But this is where we would start. That
This is
makes
where we're
sense.
starting,
Yep.
right? And it's
Yeah.
just current state versus future state. Yep.
Got it. One other thing that nabs me in the old gut here is that it looks like there's a whole lot of social worker positions open. Still, or again.
We do have, let me go back to my, because I gave this report at the Human Services Board meeting just a little while ago.
I say a whole lot, but I guess there's maybe only 3, but when there are only 10, that 3 is a lot,
Right, yes. Yeah, we have currently, in the Human Services Department right now, we have a accounts payable, fiscal associate, part-time dementia care specialist, 3 social workers in the child welfare unit. as well, and then a program or parent aid also. So I may not have updated.
No, it says vacant on
Oh,
them.
does it? Okay.
Yep.
Okay.
It's just helpful because I don't hear the human resources side or human health services side of things because
Right.
that's not our committee work. but-
Yeah. Yeah, I will say it's been more,
you know.
a little bit more challenging, especially recently. The applications are not coming in at the same pace as they were maybe 3 or 4 months ago. Because we did find some really good candidates, earlier this year. But for example, in child welfare, for the 3 positions that they have open, I think we have 1 application right now. And so fortunately, I'm just gonna knock on wood right now, fortunately, the workload is not excessive for the remaining folks. But you always, that's a kind of service that ebbs and flows.
Right.
Depending on what's reported, depending on what's going on. You could all of a sudden have one family that, that our CPS staff get a report on, and maybe there are 3, 4 kids in the home. And then we have to jump and really, investigate, and
Right.
if we have to find an alternate placement for them or whatever. So right now, it's manageable, but I'm worried, and we're trying to think about different, more creative ways of getting a hold of the social work departments which we already do. I mean, we do a good job of that, but how do we spread that a little further? We go to Winona State, we go to Eau Claire, we go to, a lot of different schools that we already know.
Schools sound like you've done a good job of reaching out to them.
Right, yes. So yeah, we do have openings, and those are some of the things that keep me up at night, yes.
Got it.
So I'll just, if you're okay at this point, can I jump in? And, okay, this is a list here of some reasons. The collaboration on emerging health and human service needs. Mental health support is a need in both departments. Coordinate training across departments. Public health has more experience with promotion and prevention, while human services has more experience with treatment. Adult services, more preventative work with adult health by public health. Explore ways that preventative adult health services connect with other service lines. Child and family services, team approach of home visiting programs and services. Combined services are better for public service and access. Collaboration between the areas provide better access for the public to reduce touches by the person. Streamline government, one contracting agent between state and county, contract support and provider management for services that could be billable to increase revenue. Finance and reporting consolidated. Unified leadership, potential for one governing board for health and human services in the future. Improve recruitment for Division of Public Health and Health Officer. Move administrative duties to the Health and Human Services Executive Director position, improving the ability to recruit for the new Public Health Officer position. So that's kind of the list. If, we thought, and a lot of our conversations have been about, let's take this as a really slow approach in making sure that we have a lot of conversations and to make sure everyone's a part of that. I apologize
I
and
was
not.
just gonna say, who of these lot of conversations been with?
Well, so I apologize that you weren't at the last meeting, but we've had a lot of side conversations and conversations at this meeting. You don't have to do anything today. We have a person that's our interim that's filling in. And so you, as a committee, could decide to table this, and she's good with staying with us for, we hope anyway, she has stated that she'd be good to stay with us for 6 months or so. She's kind of feeling that would be we feel it is it was a move in both of those meetings that the boards were interested in this conversation and wanted to see it continued forward. So that's the process that we've been taking forward. So, but certainly, if we needed to have some more discussion about it, we could do that as well.
Yes, I am generally in support of this, but I know this was years ago, but something similar was proposed and it was shot down. I just don't want to go down the same road and have this happen again.
It's been shot down several times.
There was just once that I'm aware of, but there might have been more.
Yeah.
Right.
I know I'm supportive, but at the same time, we don't want to make the same mistake over and over again. Why did it fail all those other times?
And I think Supervisor Miller had talked about this and that had happened, and he did share that. And Supervisor Miller is a proponent of this moving forward and has said that, there were some changes in the board at that time that happened. So I think you have the right leadership at the right time to do something like this. And I think looking at the list of reasons why it's a positive thing makes sense, but certainly if there are reasons that it shouldn't be done, I haven't heard any of those yet, other than it's scary or I'm not sure about it. But I haven't, no one has presented reasons why it shouldn't be done. Other than we want to make sure, and I think this is one thing that is central to what Jay and Tricia and myself and Chris have talked about, is that the health department does not lose its identity. And that's critical, and I think you have leadership that understands that. And so we're not afraid of that, and we understand that that's really critical to, but I think there's enough reasons that it's a really positive thing, and I think the timing is right. I think you have the right leadership for that right now.
I will say too, as I was kind of doing my homework as well, because obviously I've never gone through this, but I did talk with a couple of other county human services director, actually their health and human services directors. And they both told me, well, here are the pros, and I was looking for the cons too. What are the challenges? What are the barriers and that kind of thing? And what Rebecca just said with the not losing the identity, that was the only con that I heard from either one of them. One of them said, he said, Jay, he goes, he worked in Minnesota for a while and now he's in Wisconsin, but he said that's the only system I've ever worked under. He said, I see all the positives. He said, it's hard for me to see anything other than, he said, I could say, make sure that they don't get lost, their identity and their services, and still still fight for the funding and to provide the foundational or the core pieces of what the health department needs to be doing. So that was, so I spoke with a couple of different folks, and they're currently in that system. So, so those were helpful conversations for me. But yeah. So, and I think I had another point too.
And Jay, I know you talked about not allowing the Board of Health or the health department to get kind of lost in all this, but actually, as a committee and in our discussions, we've actually been talking about making the health department a stronger entity than what it has been in the last few years, and doing more community outreach. And we feel that with this combination, that we can assist more people more often and touch more people's lives more frequently, more often with this merge. And that's the goal, ultimately, is to seek those resources out and utilize them where appropriate.
And I've talked with some of our staff within the Human Services Department, and a lot of them who have been around a long time, 20 years plus. And, they said obviously when you have turnover, there's going to be, some loss of institutional knowledge and things like that, where you may not have the same relationships and things like that. And they said, it would be a really nice thing to get back to kind of where we may have been in the past, where we had more integrated programming and services and things like that. I know the ADRC works quite a bit with the health department on, to work together on clinics and things like that, like with Bridges Health from out of Winona. The Birth to 3 program in Human Services and WIC have a kind of a natural connection there as well, and so, and there's other examples. So that's the part that excites me, to kind of learn from both departments, kind of learn from each other and to become more connected, and have good referrals, back and forth and that kind of thing. So.
That's how it always was the 9 years I worked
Sure.
here.
Yeah.
We went back and forth, and we made home visits together, and we wrote reports together, and we went to county board meetings together. And so we had all that before, when we were still separate.
Yeah. And some of the folks who I talked to within our department said that they said that as well, but they said that it wasn't the same as like when you're talking about, and that wasn't the same state of, kind of the relationship. Not that it was a bad relationship, but I think when you lose institutional knowledge about this is the way we do things, this is how we're working together and that kind of thing, you lose some of that because people don't know that was the case before. And when you have a gap in positions, that's when you lose some of that knowledge, that kind of thing. So I get what you're saying, and I appreciate that. And that's where I'd like to get back to. The other advantage, and I think Rebecca alluded to this too, is with the health officer not having to worry about the administrative piece of things, the grants, the budgets, the things like that, that they have more time to focus on kind of their passion areas and strategically positioning the health department as well, to do some pretty cool things moving forward. So to have more time to do that, I guess, is my point. You know what I'm saying? So.
Yep.
So I think, may I, go ahead, were you gonna say something?
No, I was just gonna see if we need a motion.
That's what I was wondering. I mean, I'm thinking we need to decide whether we're gonna, well, I'd make a motion to approve the resolution as it stands.
I'll second it.
Right, motion made by Dawn, seconded by Stacy. Was that correct?
Yep.
Okay, great. To approve the resolution for merger of the Health and Human Services Departments. Before we take a vote, are there any other questions, or are there any other verbiage or anything that anybody has with the resolution? Hearing none, all in favor of recommending the resolution to the full county board for the transfer of Trempealeau County Health Department powers and duties to the Trempealeau County Department of Human Services, say aye.
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 And those opposed, same sign.
No.
Okay. That motion carries. I believe that there is a document there for signatures of who's present. Jay, do you have that document?
Sorry. Yes, Lynn is passing it around right now.
Okay. Perfect. And please, if anybody else has any other questions, please contact myself, Jay, or Rebecca, and we certainly can help answer any questions people might have. And again, we're moving forward in this with caution and trying to make the appropriate decisions. So I think the input from this board as well as human services members is key in all of this. All right, next up, we have the county opioid funding update. So I can give you a brief update. The committee met at the end of last month, and we discussed creating a process of creating a survey. And that survey would include health partners in the community, such as the hospital, the health department, human services department, citizen members that sit on that committee, as well as law enforcement partners. And what we're going to do is compile a list of what these entities believe are the issues, the problems, what kind of questions should we be asking in the survey. And then the committee will come back and look at all that material, and then we will create a survey. Once the survey is finalized, we will send that out on as many formats as we can, through county website, through small communities within Trempealeau County, their websites, any other partners that we have, such as the ADRC, and try and reach as many people to fill out that survey and try to at least assess the needs of what we feel the community is focused on. So I'll update you next month. We do have a meeting coming up here in, I believe, another week, that we will meet again. So I'll have another report for you next month as well. Any questions on that? All right, we'll move on to the director's report. Jay, you're up again.
Got to remember to turn my mic on. So we already talked a little bit about the appointment of Nani as the interim health officer that will be going to the board next Tuesday. This morning, today was a busy day. This morning, we had our DHS State 140 review update. I learned a lot prior to this, and I learned even more sitting through this with the state folks. The staff did an excellent job. I was just there to insert things that I might have known from certain perspectives, but we had, everybody kind of was all hands on deck, and we're answering the different sections of the review. So, and kind of my take on this review, because I've been in a lot of different state certifications, licensing reviews, that kind of thing. This one was, here are your foundational and core services that you're expected to provide as a health department. Now they wanted to know, how are you meeting these? And so with each of those competency areas or foundational areas, we went through that, and the staff were answering questions, and Chris was available. Chris Hobble was on the phone as well. But it was, we as they went through their questions, the staff had really good multiple answers for every single one of the questions, and they were satisfied, as we went through that. We will receive a report, in a letter from the state health officer as well after they've finished that report. Prior to the final report, they're going to share it with us, share their draft. And if there's anything that they put on there where, I don't want to say deficiency, but if we didn't demonstrate something that they were looking for, we have the opportunity to bring that forward and say, oh, here's another piece that we may not have mentioned. And so then they'll edit that report, they'll finalize it, and then it will be published and sent back to us on there's a confidential or a secure SharePoint site where we'll be able to see the final report and everything. And it will include recommendations on quality improvement and things like that. So we would need to take that back. I took a lot of notes while we were in there, and actually Tricia our deputy director did too, on things that we think we're doing well, but some of the staff even said, but I have ideas on how we could do this, and this, to improve it. So those were really good, I thought, ideas, and it was kind of a free-flowing conversation. But at the end of the day, they wanted to make sure that we as a health department are, meeting all of the requirements from the state and those core or foundational competencies, that are required by statute. So
Jay, were there, I guess, how many issues did they want more explanation about or have recommendations toward?
They didn't give us recommendations necessarily unless we were asking for them. So, for example, when we were talking about one of the things, it's a good thing I take notes because I can't remember everything, but one of the things they were talking about was, or a couple of different pieces, were the staff core public health competencies need to be measured at least every 2 years in some fashion, that the staff are meeting those competencies. The other piece is that those competencies need to be included in position descriptions. And so we did look at, what we have for position descriptions, and we do think they're in there, but we also asked, hey, do you have like templates, job description templates that would be proposed or suggested language that we could see, hey, could we make ours a little bit more robust, beef it up a little bit to be more on point? And so they're gonna be sending us those. I'm trying to think of some of the other pieces. Some of the metrics, on some of our outcomes for our you'll have to forgive me, I get the terminology mixed up still, because I'm not, I'm not an expert yet. But our plan, and the outcomes of our plan, and I know we talked a lot about the chip and the cha, and I'm guessing you've all talked about those things before, but some of the metrics we're wondering about, are there different ways to measure some of those things to see how well we're doing to make progress towards that outcome? And so we talked about different ways of measuring, and hey, do you have suggestions? I said, is there a group, or, which I figured there was, because I know there is for human services, it's like a regional or a state group where it's best practices, across different health departments, or if somebody has a new program or a different way of delivering a program, is there some kind of best practice group or, distribution email list, that kind of thing. And they did say there is a group, and I believe Jen was attending it as well. And so I think they brought some of those pieces back, but just kind of making sure that we're having that dialogue with the staff, because they're operating these programs every day, and if they have ideas, we want them to kind of come forward with those and make sure that they're telling us what they're thinking and how we could do things differently or better, or, who else could we work with, or how could we talked a lot about access to care, and so when you talk about different populations within our county, so whether it's the Hispanic population or the Amish population, or, you've got pockets of different groups everywhere, and how do you reach populations that are historically difficult to engage in services or preventative, kinds of conversations and education? That was some good conversation too. So it was a lot. It was 3 hours of how do you meet this, and then a lot of good back and forth about different ideas too. So
Good.
I don't know. It was very educational, and my brain is full. So
Okay.
But they were very positive, and I will say, give Jen kudos, because before she left, she had a lot of these documents submitted already. She left notes for us on different ideas on here's how we meet this and that. So we presented, I know Angela and Nani and Eddie, I mean, all the staff were very good about it. And then once in a while, I had some nuggets that maybe they hadn't mentioned yet from Jen's notes too, and so it was kind of a group effort. It was a group effort, not kind of, but yeah, it was a very good experience though. And the state folks were so nice, and they were very, very much, well, here are some examples of how you might, and then, oh, yes, we do. So, we thought that was a very positive experience, so I don't know, any other questions about the review?
Congratulations, sounds like it went well.
Yeah, I think it did. And they're very direct. The state folks are very direct. They're nice, but they're direct, so.
I would say I like the ownership that I see coming out of the department, the health department, and the employees there. And we right away started an open meeting with Chris to talk to them about this and what we were going to do. And then we brought the plans and saying, we're planning this renovation over here. Have you been a part of this discussion yet? And they hadn't, so we brought them right into the discussion so that they could give input to what they wanted to see on the floor plans, and so it's been great. I mean, I think that they really have appreciated too, having a voice with working with, some of these things too, so it's been nice to have the, work with them.
So the only other thing that's on the director's report here is, we've got contracted worker policy update, and I know we've been meeting with Susan, our corp counsel, to separate out a little bit more and create, I guess, better delineation between contracted workers and county employees, because we don't want to get stuck in a situation where it's viewed as more co-employment or something like that, because then we're on the hook for benefits and things like that, and that's not what we want as far as when it comes to those contracted positions. So we've had a lot of conversations about that. We are tweaking our contracts. Susan has also given us a list of things for both Human Services and the Health Department on what is a contracted worker as opposed to an employee. And there's a lot of things that are, the interpretation at the state level has become a little bit more concrete and more in favor of the contracted workers. So we want to be a little bit more deliberate on how we're identifying which is which. And so we're working on contracts for that. And then we're also looking at contracted workers' access to our systems. And we're trying to narrow that and limit that scope as much as possible. If they have to enter information or data into a system, we want them to do that, but we want to limit the access to that. That's from two angles. That's from the contracted versus employee, but that's also from our IT department. And Tim has gone over, and I think he even talked about it at the last county board meeting. We really have to tighten up on our cybersecurity. Not that it's not tight, because we have not had a breach, as he, told everybody, but we want to be very deliberate about access, because that's another element of how somebody might be considered or might make an argument that they were an employee as opposed to a contracted worker. So just a lot of different pieces to that we're trying to tease out and get more solid on. So that's all I have on that. Any questions about that piece? All right, that is all I have.
All right. Thank you, Jay. Next up on your agenda, we have the review of the budget and the invoices. So first, I would take any questions on the budget to date. Any questions? And then you also have the invoices. Any questions on the invoices? Okay, hearing none. Our next meeting is 5:30, December 2nd. All right. We'll go 5:30, December 2nd. Meeting adjourned. Thank you, everybody.
Thank you.